Abductor pollicis brevis goes from the tubercle of the trapezium and the scaphoid bones and the flexor retinaculum, that would go right here, and it goes to the radial side of the base of the proximal phalanx. Flexor pollicis brevis, it goes from the flexor retinaculum and the tubercle of the trapezium to the deep head that goes to the trapezoid and capitate. It also goes to the radial side of the proximal phalanx. Opponens pollicis goes from the flexor retinaculum to the tubercle of the trapezium. It goes to the radial side of the first metacarpal, right here. Abductor digiti minimi. This one goes from the pisiform, the tendon of the flexor carpi ulnaris, and the pisohandmate ligament, which is from here to here. It goes to the medial side of the base of the proximal phalanx. It's right here. Flexor digiti minimi goes from the hook of the handmate and the flexor retinaculum to the medial side of the base of the proximal phalanx. Opponens digiti minimi, hook of the handmate, flexor retinaculum, to the medial border of the fifth metacarpal. Adductor pollicis. The oblique head is the bases of the second and third metacarpals, the capitate, and the two adjacent carpal bones, which are trapezoid and handmate. The transverse head goes the anterior surface of the body of the third metacarpal bone. These go to the ulnar side of the base of the proximal phalanx of the first digit. The dabs. Adjacent sides of two of the metacarpal bones. So right here, 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 and here. And they attach up to the bases of the proximal phalanges of digits 2, 3, and 4. So this one goes to here, the fourth digit. This one goes to here, the third digit. This one to the third digit again, and this one to the second digit. The pads. The proximal attachment is the palmar surface of the second, fourth, and fifth metacarpal bones, and they also go to the proximal phalanges of digits 2, 4, and 5. So this one would go to this side, this one to this one to this.